Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Essential hypertension. Introduction. Hypertension, or high blood pressure, is a common condition that affects 1 out of every 3 adults. Hypertension is also called the silent killer because it often has no symptoms. Hypertension can lead to severe health problems if it goes untreated for a long time. This program explains hypertension and how it can be prevented and controlled. Blood pressure. The cells of the body need oxygen and food to survive. Oxygen and nutrients are carried to all parts of the body through the blood. The heart pumps blood out of its chambers through blood vessels. The blood vessels that carry fresh blood from the heart to the body are called arteries. Blood pressure is the force of blood as it presses against the walls of the arteries. 2 numbers are used to describe blood pressure. The top number, called systolic blood pressure, measures blood pressure when the heart pumps. Ideally, systolic blood pressure should be equal to or less than 120. The second number is lower than the systolic pressure and measures blood pressure when the heart rests. It is known as diastolic blood pressure. Ideally, diastolic blood pressure should be 80 or below. For example, a patient may have a blood pressure of 125/70. This means that the patient has a reading of 125 systolic and 70 diastolic blood pressure. Hypertension. High blood pressure is also known as hypertension. It is a common condition in which the force of the blood against the artery walls is too high. Blood pressure varies all the time. It is common for it to differ by 10 to 20 units when it is measured at different times, even minutes apart. Exercise or emotional stress can increase the blood pressure. The increased blood pressure allows more blood to be pumped to the body to help the body cope with increased activity or stress. The body can tolerate a temporary rise in blood pressure. Because of these normal variations, healthcare providers do not diagnose a patient with high blood pressure unless repeated measurements show it to be consistently high. Your healthcare provider can diagnose high blood pressure based on 2 or more in-office readings. A blood pressure reading of 120/80 is ideal. Anything above those numbers is considered high blood pressure. 1. Elevated blood pressure is when your systolic readings are between 120 and 129 and your diastolic reading is less than 80. 2. Stage 1 hypertension is more serious than elevated blood pressure. It happens when your systolic readings are between 130 and 139 or your diastolic readings are between 80 and 89. 3. Stage 2 hypertension is more serious than Stage 1 and means that your systolic readings are at least 140 or your diastolic readings are at least 90. 4. Hypertensive crisis is when your systolic readings are over 180 and or your diastolic readings are over 120. This is very serious. If you have it, you must see your healthcare provider right away. If your blood pressure measures high, discuss lifestyle changes with your healthcare provider. Your healthcare provider may also prescribe medications. High blood pressure increases your risk of heart attack, stroke, and heart failure. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes of hypertension. The exact causes of hypertension are not known, but certain risk factors are associated with high blood pressure. Risk factors for high blood pressure include being overweight, eating a diet that is high in salt and saturated in trans fat, lack of physical activity, smoking tobacco products, and abusing alcohol. Stress. Certain health conditions increase the risk of hypertension. These include high cholesterol, heart disease, kidney disease. Though some people are at a higher risk of developing hypertension, anyone at any age can develop high blood pressure. People who have a family history of hypertension are more likely to develop the condition. African Americans are also more likely to have hypertension. Complications of hypertension. Over time, high blood pressure can damage blood vessels throughout the body. High blood pressure can cause blood vessels to widen and become weaker. This can lead to an abnormal widening of the blood vessels, which is called an aneurysm. Aneurysms can bleed and cause death, especially when they are located in the blood vessels of the brain or the aorta. The aorta is the largest blood vessel in the body. Over time, blood vessels become narrower from the buildup of cholesterol and other debris. The muscles of the arteries can thicken due to high blood pressure, which can cause this narrowing. Narrow blood vessels restrict and may even block the flow of blood. This lack of blood supply can cause damage to the organs in the body. The blockage of arteries in the brain can lead to a stroke. Strokes can lead to paralysis, speech problems, and death. Blockage of blood vessels in the kidneys can lead to kidney failure. Kidney failure is the inability of the kidneys to remove poisons from the blood. Kidney failure can lead to death unless patients receive dialysis treatment. During dialysis, patients are hooked up to a machine 3 to 5 times a week for 4 hours at a time to clean their blood. Blockage of blood vessels in the eye can lead to vision problems and blindness. The blockage of an artery that supplies the heart with blood may lead to a heart attack. This weakens the heart and may lead to death. High blood pressure can cause the heart to get tired from pumping blood at such high pressure. This is known as heart failure. It can result in breathing problems and death. There is a higher chance of developing complications of high blood pressure if the patient has other medical conditions, such as diabetes, high cholesterol, obesity, previous strokes or heart attacks. Diagnosing hypertension. The damage to blood vessels that is caused by high blood pressure may take years to develop. During that time, patients with hypertension may not have any symptoms. Even though most patients feel no symptoms when their blood pressure rises to an abnormally high level, some patients with hypertension suffer from headaches or fatigue. The only way to detect hypertension early enough to prevent serious complications is by checking your blood pressure regularly. A healthcare provider can help check for hypertension. Healthcare providers use an inflatable arm cuff to measure blood pressure. The cuff is placed around the patient's arm. This test takes a couple of minutes and it is painless. Healthcare providers will also ask questions about the patient's medical history. A physical exam will be done. A patient is diagnosed with high blood pressure if repeated tests show that their blood pressure is consistently high. Controlling hypertension. High blood pressure can be controlled with lifestyle changes and medical treatment. Controlling hypertension involves a lifelong commitment to healthy eating and lifestyle habits. Medications may also be needed to bring high blood pressure back to normal. Regular follow-up care with a healthcare provider is also essential to make sure that hypertension is controlled. A healthcare provider can also check for signs of complications. Losing weight, exercising, and eating a healthier diet are usually all that patients need to do to bring their blood pressure levels back to normal. Eating a diet that is low in salt and saturated in trans fat can help control high blood pressure. The words salt, sodium, and Na on food labels all mean salt. Your healthcare provider may recommend a reduced sodium diet. Talk with your healthcare provider about how much sodium is right for you. Eating less saturated in trans fat not only helps people lose weight and keep blood pressure levels normal, but it also helps prevent heart attacks and strokes not related to hypertension. Aerobic exercise also helps people reduce blood pressure as well as lose weight. It helps improve heart performance and decreases the chance of having a heart attack. Walking, biking, and swimming are all examples of aerobic exercise. Check with your healthcare provider before you begin an exercise program. Quitting smoking if you smoke and drinking less alcohol can help control your blood pressure. Finding ways to control stress can also help. Stress can be managed through exercise and relaxation techniques such as meditation.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Hypertension, or high blood pressure, is a common condition that affects 1 out of every 3 adults. Hypertension can lead to severe health problems if it goes untreated for a long time. The exact causes of hypertension are not known, but certain risk factors are associated with high blood pressure. Though some people have a higher risk of developing hypertension, anyone at any age can develop high blood pressure. Risk factors for high blood pressure include being overweight, eating a diet that is high in salt and saturated and trans fat, lack of physical activity, smoking tobacco products and abusing alcohol, stress. Over time, high blood pressure can damage blood vessels throughout the body. The damage to blood vessels that is caused by high blood pressure may take years to develop. During that time, patients suffering from hypertension may not have any symptoms. The only way to detect hypertension early enough to prevent serious complications is by checking your blood pressure levels regularly. A patient is diagnosed with high blood pressure if repeated tests show that their blood pressure is consistently high. High blood pressure can be controlled with lifestyle changes and medical treatment. Controlling hypertension means a lifelong commitment to healthy lifestyle habits. Medications may also be needed to bring high blood pressure back to normal. Regular follow-up care with a healthcare provider is also needed to make sure that hypertension is controlled. A healthcare provider can check for signs of complications. Thank you for using Explain.